If you are over the age of 60 and currently taking medication for your heart, diabetes, or blood pressure, I need your absolute attention right now. The small yellow spice sitting in your kitchen cabinet is not just a cooking ingredient. It is a powerful, pharmacologically active compound called curcumin. And if you take it incorrectly, or worse, combine it with certain prescription drugs, that tiny health boost you were seeking could turn into a life-threatening internal crisis. It is a hidden danger most wellness videos will never warn you about. I am Dr. Alex, a pharmacist and nutritional scientist specializing in geriatric health. I'm skeptical of health fads, but fiercely committed to patient safety. My mission today is to protect you from the single biggest, yet most preventable, supplement mistake seniors make every single year. I am talking about the turmeric and Tylenol trap. For millions of seniors, combining curcumin with medications like warfarin or even common pain relievers can double your risk for dangerous side effects, from uncontrollable bleeding to liver damage. In this next 20 minutes, I'm going to reveal the exact 7 categories of medications you must check against your curcumin supplement today. We are going to move with a sense of calm authority, but I need you to understand the urgency of this information. First, let's acknowledge the promise of curcumin. It's real. This ancient Indian remedy is celebrated for potent anti-inflammatory and antioxidant properties. The science is indeed promising for 2 major concerns of aging. Studies show that curcumin can significantly help manage the painful symptoms of osteoarthritis, providing relief comparable to some over-the-counter NSAIDs for joint pain and stiffness. Furthermore, preliminary research suggests curcumin may support brain health by boosting a neurotrophin called BDNF, potentially helping to stave off cognitive decline. This is why you see it everywhere. It taps into a deep human need, finding a natural path to better health and longevity. But here is where the science lesson and the danger begins. Part 1. The bioavailability crisis. The true power of curcumin is undeniable for longevity, but for seniors on any prescription drug, the silent danger of drug-supplement interaction and the hidden bioavailability crisis make standard turmeric consumption more of a risk than a reward. This is insight number 1. Most of the curcumin you buy is biologically useless. Curcumin has notoriously low bioavailability. Think of it this way. Your body sees curcumin as a foreign substance. Your liver works overtime to metabolize it quickly, and your gut poorly absorbs it. So, much of the expensive supplement you swallow simply gets processed and flushed out. This low absorption rate is why many people believe turmeric supplements don't work. To counteract this, manufacturers began adding an ingredient from black pepper called piperine. Piperine is a game changer. It dramatically increases curcumin absorption by up to 2,000%. This sounds like a miracle, but this is the very beginning of the trap. Piperine does not selectively boost curcumin. It essentially hits the pause button on crucial liver enzymes, specifically the CYP3A4 enzyme, which is responsible for breaking down about 50% of all prescription drugs you take. When you slow down this enzyme with piperine, you slow down the processing of your medication. The result? The level of your prescription drug in your bloodstream spikes to dangerous, unregulated heights. This turns your normal dose into an accidental overdose. You are not just taking a health supplement, you are playing with your body's essential drug clearance system. This is the hidden bioavailability crisis, and it sets the stage for the 7 deadly drug combinations we must review now. Part 2. The 7 deadly combinations. This section requires your undivided attention. If you recognize any of these drug names, you must discuss turmeric with your physician immediately. Beehive 1. Blood thinners. This is the most critical and potentially lethal combination for seniors. Curcumin is a natural anticoagulant. That is the entire point. It reduces inflammation, which is achieved in part by interfering with platelet aggregation. It thins the blood. If you are already on a prescription blood thinner, you are essentially doubling the effect. The risk is not a little extra bruising. The risk is a catastrophic bleeding event. This could mean an internal hemorrhage, a severe gastrointestinal bleed, or bleeding into the brain from a simple fall. The medications in this danger zone include warfarin, commonly known as Coumadin. We have documented cases where curcumin use destabilized a patient's INR, pushing them into a high-risk bleeding state. Clopidogrel, often prescribed as Plavix, high-dose aspirin, used for cardiovascular protection. And the newer anticoagulants like rivaroxaban or Xarelto. Combining curcumin with any of these drugs drastically escalates your vulnerability. Your physician needs to know about every supplement you take to manage this risk. Beehive 2. Diabetes medications. This is the silent danger for millions managing type 2 diabetes. Curcumin has a genuinely beneficial effect. It helps lower blood sugar. It can improve insulin sensitivity and generally reduce blood glucose levels. However, when you combine a potent blood sugar-lowering supplement like curcumin with prescription diabetes drugs, you create a major risk for hypoglycemia. This is a sugar shock, where your blood sugar drops too low too fast. Hypoglycemia can lead to shakiness, dizziness, confusion, and in severe cases fainting or coma. For an elderly person, fainting is not merely embarrassing, it's a direct ticket to the emergency room, often resulting in broken bones or head trauma. The common drugs in this interaction include insulin in all its forms, metformin, one of the most widely prescribed diabetes drugs, glipizide and glyburide. You must monitor your blood sugar closely if you introduce curcumin. A doctor's guidance is mandatory to adjust your medication dose downward if necessary. Beehive 3. Liver-harming drugs. Now let's address the elephant in the room, acetaminophen or Tylenol. Millions of seniors take Tylenol every single day for chronic aches and pains. Both curcumin and acetaminophen are processed by the liver. When taken in high doses, curcumin, even without piperine, places a burden on liver function. The danger isn't from a single dose, it's from the cumulative, long-term stress placed on the liver when you take two or more substances that are hard on the organ. If you are taking curcumin supplements daily and simultaneously relying on acetaminophen for joint pain, you are potentially increasing your risk for hepatotoxicity, that is, chemical-driven liver damage. The anti-inflammatory benefit of curcumin should replace the need for Tylenol, not be taken alongside it. Beehive 4. Blood pressure drugs. This trap is closely linked to the piperine crisis we discussed earlier. Amlodipine, often sold as Norvasc, is a cornerstone medication for high blood pressure and angina. Amlodipine is metabolized, or broken down, by the very same CYP3A4 enzyme that piperine inhibits. When you take a curcumin supplement enhanced with piperine, the drug is not cleared from your system fast enough. Its concentration spikes in your bloodstream. The result is an exaggerated effect. Blood pressure drops too low, leading to hypotension, dizziness, and a massive increase in side effects like lightheadedness or irregular heartbeat. While clinical human studies are still catching up, the theoretical and animal evidence is overwhelmingly clear. This is a high-risk combination you must avoid. Beehive 5. Cholesterol drugs, statins. Millions of seniors rely on statins like atorvastatin or Lipitor to control cholesterol and prevent heart attacks. The combination of curcumin and statins carries a specific alarming risk: myopathy. Myopathy is a condition that leads to muscle weakness, muscle pain, and sometimes the breakdown of muscle tissue. Statins are already known to carry a risk of myopathy, and certain components in curcumin may increase the statin's blood levels. This increased concentration magnifies the risk of severe muscle pain and damage, turning the pursuit of heart health into a painful complication. Beehive 6. Immunosuppressants and chemotherapy. This is complex, but the rule is simple. If you are undergoing cancer treatment or managing a transplant, do not take curcumin without explicit oncology clearance. Curcumin is extremely potent. It interacts with multiple cellular pathways. In some cases, curcumin's antioxidant effects have been found to reduce the effectiveness of certain chemotherapy drugs like doxorubicin or cyclophosphamide. It can literally counteract the mechanism designed to kill cancer cells, making your expensive and grueling treatment less effective. Do not gamble your life on a supplement when fighting a disease this serious. Beehive 7. Antidepressants and anxiety meds. Finally, we address mental health. Many seniors are prescribed medications like tramadol for pain or various benzodiazepines for anxiety. These drugs are often metabolized by those same liver enzymes, the CYP450 pathways, that curcumin and piperine interfere with. By inhibiting the breakdown of these drugs, curcumin can lead to increased concentrations, causing enhanced side effects like sedation, confusion, or increased risk of toxicity. For the elderly, this heightened sedation risk directly translates to a higher risk of falls and hospitalization. The key takeaway is this: curcumin is not just a food, it is a pharmaceutical agent that demands the respect of a drug. Its benefits are compelling, but its powerful mechanism of action is precisely what makes it dangerous in combination. Part 3. The Safety Checklist. The goal is not to eliminate turmeric, but to use it safely and intelligently. Here is the 3-step safety checklist you need to implement starting today. Step 1. The Golden Rule and 3 questions. Before you restart any curcumin supplement, you must talk to your healthcare provider. Do not just say, "Is turmeric okay?" That is too vague. You need to ask these 3 precise, doctor-level questions. 1. I am taking a curcumin supplement enhanced with piperine. Given my current regimen, specifically warfarin, metformin, or amlodipine, is there a risk of excessive blood thinning or drug concentration spikes? 2. Since I am taking this supplement for inflammation, should I discontinue my daily acetaminophen or ibuprofen use to protect my liver? 3. I understand curcumin should not be taken long-term. What is the maximum duration, in weeks or months, that you recommend for me? By asking these questions, you transition from being a patient to being an informed collaborator in your own health. Step 2. The duration and dosage limit. The truth about curcumin is that long-term safety studies are lacking. The National Center for Complementary and Integrative Health, or NCCIH, states that conventionally formulated curcumin is likely safe for up to 2 or 3 months. If you've been taking it for years without a break, you are operating in an unstudied safety zone and potentially straining your system. Your goal should be cyclical use, a 2 to 3 month cycle followed by a 1-month break. As for dosage, studies showing benefits for inflammation typically use doses between 500 and 2,000 milligrams of curcuminoids per day. Stick to the low end initially and increase only with medical guidance. Step 3. How to choose curcumin that isn't useless. Given the low bioavailability crisis, simply buying the cheapest curcumin powder is almost certainly a waste of money. You need a high-absorption formula that has been clinically studied and is transparent about its mechanism. Look for specific formulations like curcumin phytosome, BCM95, or theracurmin. These advanced methods dramatically increase absorption without relying solely on piperine, thus mitigating the worst drug interaction risks. If you experience any warning signs, new bruising, persistent nausea, severe stomach upset, or dark urine, stop the supplement immediately and consult a doctor. This is your body's signal that your liver is under stress. Conclusion and your next step. The journey to health in our senior years is a balance. The true power of curcumin is undeniable, but for seniors on any prescription drug, the silent danger of drug-supplement interaction and the hidden bioavailability crisis make standard turmeric consumption more of a risk than a reward. Natural does not mean harmless. It means powerful. And with power comes responsibility. Before you make any changes, check your medicine cabinet again. Now, I want to hear from you. This is our resonance point. Which specific medication are you currently taking that you are now double-checking for a curcumin interaction? Tell me in the comments below. Let's create a community safety check, helping each other stay safe. Avoiding risks is the crucial first step. The second step is finding safe, effective, natural solutions to relieve your most common chronic pains. If you are looking for a natural, safe way to relieve joint pain that avoids the drug interaction risks we discussed today, then you need to see my next video. Click here to discover the only supplement that stops arthritis pain in 7 days. Thank you for watching, and please, prioritize your safety. Disclaimer. This content is for informational purposes only and is not a substitute for professional medical advice, diagnosis, or treatment. Always consult your physician or qualified health provider with any questions you may have regarding a medical condition or medication interaction.